Hello colleagues and dear friends, this is from PACES Preparation Pulse Academy. I want to highlight today in my short talk about the clinical skills that we have to overcome during our clinical consultation station. Actually, all 7 clinical skills are checked in this clinical consultation scenarios. So the clinical skills: A is physical examination, B is identifying physical signs, and C is clinical communication. D is differential diagnosis, E is clinical judgment, and F is managing patient's concern, and G is maintaining patient welfare. Today I want to give you the important tips about acromegaly case, and here I would like to highlight only 2 clinical skills in this short clip. So the first thing is I would like to highlight how to address the concerns of the patient related to acromegaly and how to maintain the patient's welfare. So to understand the concern of the patients, once you finish your history, like we have 15 minutes interaction with the patient and then 5 minutes interaction with the examiners during clinical consultation. So you have 15 minutes. So I will suggest that you should complete your history in 8 minutes, and then you can ask here what could be your concern. So the patient can raise the concern related to his symptoms, related to the diagnosis, how you will confirm the diagnosis, or what could be the treatment option. This could be another concern of the patient. And then the patient can ask you about the prognosis and long-term outcomes related to acromegaly. So to understand, basically here I will focus mainly on symptoms of the patient, how they are presenting in the exam. This will give you the information about how the cases are coming, acromegaly cases are coming in the exam. So they can present with headache, they can present with visual problem, they can present with features of obstructive sleep apnea or carpal tunnel syndrome features. Then patient can present with uncontrolled diabetes and hypertension scenario, can present with loss of libido, patient can present with changes in the facial appearance, changes in the size of the ring, or changes in the size of shoes. So these could be the presentations of the patient, different type of presentation. So when you will go inside, this presentation will be giving you hint outside when you are outside the station. So when you go inside, you will see the patient is sitting like with features of acromegaly. So you will take the targeted history, and after finishing the history, you should ask the patient, "May I know what is your concern?" So the patient first concern could be, "What is wrong with me, doctor?" So you have to tell what is your differential diagnosis, or top of the differential diagnosis you can say about the acromegaly. It's a medical condition in which there is benign growth at the base of your brain. There is gland called pituitary gland. So there is benign growth in the pituitary gland. As a result of this benign growth, it is producing excessive amount of hormone known as growth hormone. And if the patient is having headache, you will say that this headache is because of this growth, because of this benign growth. Okay, there are different causes for headache. We can discuss in our upcoming course what could be the different causes of headache in a patient with acromegaly. So at present, so I'm just telling you how to address the concern. So I'm going to give you painkiller as a temporary measure, and it is very important to establish the diagnosis. So I will do urgent investigation for you. Okay, if the patient is having visual problem, presented to you with visual problem, so we can say as your vision is impaired, as your vision is impaired, I'm afraid to tell you, to inform you that you have to stop driving immediately and you have to inform to DVLA. So this covers the welfare of the patient also. Okay, and then what you are going to do, doctor, for me? I'm going to do some urgent blood test for you, an urgent scan, that is MRI of brain, and I will refer you to the eye specialist to check your visual problems. Okay, the patient can ask different questions related to his symptoms. So if he is presenting with features of uncontrolled diabetes and hypertension, he may ask you, will these be controlled after my treatment is done? So the answer will be like, it depends on the duration of your illness, and it depends on the severity, and it depends on the outcome of the treatment. Like if we are going for subtotal hypophysectomy for removal of the pituitary tumor, we have to see how much it's responding to the surgical treatment, then the medical treatment. Okay, so as far as the diabetes and hypertension is concerned, we can say like it will be easier to control them, but they may not disappear, they may not completely relieved after treatment of acromegaly. Okay, so these are the points that we have to focus in this short video clip. So I highlighted some of the important concern of the patient. And to highlight the welfare of the patient, it is very important to address the welfare. We have to deal the patient respectfully, and we have to give them immediate some important points so we will not lose the marks of welfare. Like if the patient is having headache, we should offer them, do you have headache right now? Should I arrange for you some painkiller? So by this means you will not lose your marks related to welfare. Moreover, stopping from the driving is also is the welfare for the patient, and you can ask for any other support or help for the patient. So this is for today, and we will discuss this case in our upcoming course in detail. So I will suggest you to subscribe my channel and to join my WhatsApp group and be in touch with us. Similarly, we will add more tips and